here today. I'm going to explain how to take care of your back so you don't have back pain and back problems throughout your life. Basically, the idea is to have a strong core, and there are certain exercises which were taught to me by a physical therapist after I had a back issue with a disc in my lower back. So I had a back problem with the disc right around my waist level, and she taught me these exercises, and I've been using them for the past about 20 years, and they've enabled me to do normal activities without having to worry about my back or causing back pain. These can be done really by anybody, and the one caveat is if any of the exercise hurt, if you currently are having a back issue and your back hurts, you can still try the exercises. If any of them hurt, then you don't do them. You can try them again in a few days. If it's just a little bit sore when you do it, that's okay. You can still do them. Maybe you limit the quantity. But if something hurts, use common sense. Don't do it. So there's not very many exercises, and the goal is to strengthen your core, and then after that you have to lift things properly, and that's basically it. I'll explain more as I start doing the exercises. For the first exercise, you lie on your stomach and you're going to lift alternate arms and legs. So you do like 12 on each side. So you do 12 of those, and then the other side. I'm not doing 12, but you get the idea. This works the small muscle in the small part of your back, lower back. Okay, the next ones, the rest are...
Maybe I should get out of the frame.
It's all right. The next one
Alright, cool.
is on your back. And for the first part, you have your knees up. And the first part is learning to put your back, not just learning, but it's an exercise, putting your back in the neutral position. So your spine is normally curved like that, and so the discs they're like this. They're a little bit angled, and what you want to do is make them so they're straight. So in order to do that, you're really pushing your waist into the floor. You're going to compress your stomach muscles and push your waist into the floor. So if you're doing it properly, you can't get your hand underneath your waist anymore. So normally I can squeeze my hand under there. That's because my back is not in neutral. Once I compress my stomach, I can't get my hand in there. So my back is flat against the floor. And this is very important for the next exercise. You have to hold this position because if you don't hold it when you do the next exercise, that could hurt your back, because essentially when your discs are at an angle to each other, and then you're doing other exercise, you can be pressing the disc in the wrong part. You don't want to do that. Okay, so for this exercise, you just put your back in the neutral position. I normally just do this about 6 times, and you should feel, you can also feel your stomach should be tight. So you can't get your hand back there, your stomach is tight. So you do that about 6 times, practice that motion. And this is also something you want to get in the habit of when you're about to lift something heavy. And I know doctors tell you you're not supposed to lift anything heavy after you have a back problem, but you can lift some things, that aren't real heavy, but if they have any weight to them, what you do is you compress your stomach muscle, put your back into the neutral position, while you're standing. And then keep it that way the whole time you're lifting, and that protects your back. And this, you won't be able to do this when you first start these, but after you've done these for a number of weeks and months, it becomes second nature. If you go to lift something off the floor, you compress your stomach. Okay, so the next exercise, you hold your back in the compressed, the neutral position, and then you're going to do leg lifts. You do 12 on each side. So the whole time my stomach is compressed, and you can check it by feeling it, either the bottom or the top. So you do 12, just lift as high as you can.
and then you switch the other leg. I usually take a couple breaths, let my stomach relax in between the sides. So I take a couple breaths, my stomach's not neutral, and then I'm ready to do the other side. I put my stomach back into neutral, or my spine that is, and then I do 12 on the other side. Okay, and the next one is a bridge. This one you don't have to compress your stomach. So you just go in a bridge position, and then you just alternate lifting your legs. Try to keep your butt up so you're in a triangle. So I do 12 on each side, so 24 of these altogether. Okay, once you're done with those, then it's curls. The way I do the curls is I try to touch the far side of my knee when I come up. So just like that. Learned that in Taekwondo with Joey. And so you do however many you can. I normally do like 35 and then 15, and then I'll do 15 to the side. Maybe 2 sets of those of 15. You don't have to worry about the neutral position for those. So you just do sets of those. You start off doing whatever you can, and you try to add to it till you get to a good number. Then do the alternates. Okay, now after you've been doing that a while and it's getting easier, there's another exercise they added in. This wasn't taught to me by the therapist, but if you're doing all the rest of them well for a while, you can add in bicycles. And for these, you just start off very slow. Make sure you're not hurting yourself or your back. Anything hurts, you don't do it, or you stop. But basically, you lift your legs. And for this, I do have my back pressed down, so I am in a neutral position to do them. Just alternating. Okay, but for beginners, I wouldn't do that right away. Wait till you've done the other ones for a few months. Okay, and then the last exercise is just a back bend. And I was told on this, okay, you put your feet shoulder width apart, feet facing forward. If your feet are like this, you're not working the correct muscles really. So it's feet facing forward. You just lean back as far as you can go. At the end of your leaning, you can exhale, which will allow you to go back a little farther. And you do like half a dozen of those. And the reason those are important is because throughout every single day, every motion you make, you reach, anything, it goes through your back. It's all, any movement you make during the day, it kind of goes through your back, so you have to have flexibility in your back to allow that. That's pretty much it. I've been doing those exercises every day. My doctor, I went to a back specialist, and she told me I'd have to consider myself handicapped. This was in the 90s, and I wouldn't be able to do, activities like racquetball or sports, anything like that. I wouldn't be able to lift heavy objects. Well, guess what? I've been doing these exercises every day, and I can do all those things, in moderation. I don't play racquetball every day. It's got a lot of twisting, but I play a couple times a week. And I can lift fairly heavy things as long as I'm putting my back in neutral and I'm careful about it. When you bend down to pick something up, you got to use your knees. You don't want to bend over like that. You start doing that every time, and it just gets to be a habit, so it's easy. And anytime you're lifting something heavy, just compress that stomach while you're doing it. That protects your back. And eventually you'll get a six-pack. I have a six-pack, but I got to lose 10 pounds for it to show. But I can tell, if I compress it and I feel my muscles, yeah, I got muscles because I do that exercise every day, and it's not a difficult thing. It doesn't take very long. You don't have to have any special equipment. You can do it preferably on a rug or an exercise mat. The only way, like on a hardwood floor, it's not really good on that, but on a regular rug with any kind of padding, that's fine. A bed is usually too soft because, you know, you move into it too much. So I recommend either an exercise mat or just any normal carpeting works. And that's it. Good luck. Take care of your back. Thanks for listening.